Hey, hi Saurav, how are you?
Great, sir. How are you?
I'm absolutely fine. Good to hear, man.
Thank you for your valuable time, sir, for the
Well,
students.
absolutely. The pleasure is all mine.
You are having always a very busy schedule, as I keep seeing on Instagram.
Yes, yeah, I do have a extremely hectic schedule. I'm in Calicut actually. I'm coming from Bangalore and then again heading back to Bangalore. So yeah, I'm always on the run.
Yes, sir.
That's how it is.
Sir, many are joining. Can we wait for 2 minutes?
Yeah, yeah, no problem, no problem. I'll wait for it. No problem. Yes, Saurav, I'm ready.
Sir, previously also we conducted many meetings, but I haven't seen such a huge response. People, the limit of Google Meet is only 100 and
Okay,
means it is almost full.
okay. I didn't know that because I'm not using a Google Meet a much. So well, thank you for everyone joining in, and it's very nice of you to organize such a meeting. Good to see you all.
There is a huge craze, sir, about your meeting.
Thank you, man. I hope I'm doing my job well.
So, sir,
Yes, sir.
should we start now?
Yeah, absolutely. Yes.
Yes, sir. So thank you, sir, for being in the session. First, sir, I would like to ask you. First, we will be means talking about the first year students, those who have those who are coming in the first year. Uh, what should be the approach to anatomy from the beginning of the first year itself, according to you?
The one who's going to join.
Yes, yes, for the 2024 batch.
Well, the approach is pretty simple actually. I always say that there is a little, myth about the subject that people believe that it is a subject to mug up, and there's so much of rote learning is there. It's a very dry subject. But I'm sure that when people go through the lectures, like I'm not saying just my lecture. I mean anyone who teaches in more detail and goes into the concept, they realize that it's a beautiful story. Which start with a general anatomy and it's like learning a new language only. If you don't know the alphabets of the language, then obviously you'll find the language with difficulty. So, getting a good hold and the grip on the general anatomy is very important. Attending your college lectures are also extremely important. I mean, people, I'm not saying that if they're using the app, they should not get reluctant of not attending the college lectures. These apps, which are formulated, are basically to make your life easier. But you should not refrain from using the textbook and going to the colleges, attending dissection hall. That's one thing that you should never miss, that you going to the DH and all that. So I think the start is very important, and start enjoying the phase from the general anatomy, and eventually you'll get the way. I would say that just but yeah, make sure that you keep your basics very very strong here. Don't start haphazardly with the gross anatomy or something.
Sir, as you started with general anatomy, I would like to ask, in
Yeah,
first year beginning means there is a rush to go into the gross part, and then
yeah.
we get very less time for the general anatomy. So, according to you, it is how should we cover general anatomy at the beginning itself?
Uh, Sort of what I've seen is general admin people don't understand one thing, because when a person comes into the MBBS, they don't realize that how much of general anatomy they have to read. Because even people ask me, sir, you have not recorded the lymphatics and you are not recording the neurology part here.
Yes.
And then I'll keep telling them, so we have to understand that amount of general anatomy, which will make your life in the gross anatomy easier. It's not that you're going to learn everything in the general anatomy. We basically plan our studies based on what is given in the books without realizing what is actually important. So, in general anatomy, I think the one thing that one should be very clear about, I would say axis plane and all that. That is very basic. That everyone should know that here. And it's about. I mean, the people who are like, I'm sure many of must be the people in this group are the one who are going to give the exam, and they realize that we at the end of the day remember big things and we forget all the small things, and it's the basic where we get stuck on. And especially all these MCQ based exams, and now what they're testing you is, and even for the PG entrance examination, they're testing you on your basics itself here. So it's very important that in the general anatomy, your musculoskeletal system, just understand that, try to understand those terminologies, what is the meaning of teres and latissimus and longus and brevis and all that, so that you kind of get acquainted to the language here. So, Saurav, you rightly said that one should not rush through the general anatomy part. But again, don't invest too much of time in the general anatomy. Musculoskeletal general anatomy is important. Just do with that, and eventually you will understand everything. All these blood vessel and lymphatics and all that. That with the gross anatomy you can cover it up.
Thank you, sir. Sir, there are many anatomy books which are available in the market. So in the beginning of first year, many people get confused to which one to read. Which one you would recommend out of so many?
Sort of I'm not going to advocate any group. Not to be honest, I do have my own anatomy group also, but that group I'm using it to post the questions which are generally MCQ based questions only. That is for the mainly for the
Yes, yes.
the people who are going to prepare for the PG entrance examination. Although it is beneficial for the people because everyone is having MCQs nowadays in their slot, but I would not advocate any group. I mean, देखो यार इससे पहले भी people were reading anatomy. ऐसा तो नहीं है कि this is the first time they're reading it. Like there was a time people we read anatomy. Like I'm from a 99 batch, so imagine like I've read anatomy. There was no forget about any group. There was no WhatsApp. Nothing was there, and still people used to read it. So uh, it's just that don't get into too many things. That's the only thing. Whatever group or your whatever online resources you're sticking to, try to stick to that one source or maybe a couple of sources, but not more than that. Nowadays, when we have so many resources available, people are living in this so-called FOMO. They're like everyone is having a
Yes.
fear of missing out. That should not be there. So I think any group will do, and I'm not going to advocate. But there are good anatomy. I've seen some good anatomy channels. I would say I have my own YouTube channel, like, but again, as I said, I'm not only posting the UG content. I'm using PG both content. I've been posting there, but I've seen some good animation channels also. I can send you some link. You can share it with the students if they want to go through that.
Sir, I was means asking about the books. I heard groups actually.
Acha, I thought you're talking about the group. Okay, okay.
No, I
Uh,
was books.
okay, okay. So you were asking me about that. Which books are to be read in the first year?
Yes, there are so many books. So which one you'd recommend?
If you look at all the books which are available right now, I mean, no offense to any of the author because I know most of them. I know Dr. Vishram Singh also very well. He's someone who I've met many times, and we have worked together also. And I've met Dr. Krishna Garg also. She's in Lady Harding. She's wrote Bidi Chaurasia. All these books are more or less same only, honestly. It's just the way a presentation, the way the sequencing is done, it is a little different here. But in the current scenario, what I've seen, the Dr. Vishram Singh books are a little better for the undergraduates here. The way they are presenting the material, that's why I'm saying it, they're better. Otherwise, there's not much of a difference. And even for the neuroanatomy also, although some people might like to read neuroanatomy from Snell's neuroanatomy and all that, that is not bad book at all. But I would still recommend the Vishram Singh book for all the gross anatomy. Histology may honestly don't need a book as such. I mean, if you attend the college lectures and you have so many online resources available, you can just go through them. That would be sufficient. And embryology, if you want to stay up to date in the embryology, then Langman is a very good book to go with. I know people generally read IB Singh, but Langman is a good book. Langman edition, because at the end of the day, you will be preparing for the next exam also in future. And the only book which I find is very much up to date regarding the timelines and all those derivatives and all that. It is Langman. So that would be my recommendation in that.
Sir, many were asking, should they follow any standard book like Gray's Anatomy in the first year if they can
नहीं
manage
देखो
time?
देखो Gray's Anatomy. First of all, I don't know how many people know this, but there are two different Gray's Anatomy we have. There is one Gray's Anatomy which is lying in my room only. I don't know where it is. I need to find it. That Gray's Anatomy is different. That is a 42nd edition Gray's Anatomy. That's this much of a book here. So you just can't read that book in undergraduate. That is not possible. Like this, nobody can read that book in first year. And there's another Gray's that is a student's Gray's. Student's Grace is a different book, and Student Grace is like an atlas. It's like less of a text and more of a pictures are given, and that is really good actually. That's a very good book here. In my time, there used to be Netter's Atlas only, but later on, many new atlas came. Like Auckland is there. We have like this one, as I said, this Student's Grace is there. So Student Grace is a decently good book here. But again, I'll tell you one thing, don't change the source. I mean, if let's say, for example, you're reading a topic, for example, you're reading shoulder joint, read the shoulder joint from Vishram Singh only. That is fine. But when you're looking for those ligaments and those bursae and everything, then you can just refer any atlas here. Reading two different books is never a good idea. So using a textbook and compiling with any atlas, every atlas is good here. Times is a very good atlas here. But for a first year student, I would say the most convenient atlas current days is Gray's Anatomy. That is a student's Gray's, but the people should not confuse the student's Gray's with the main Gray's.
Thank you, sir. So some were asking in cadaver, many things are not visible. Then how
Yeah.
to means see visualize those structures and in total they were asking how to means utilize the cadaver.
Uh, s- Sort of, there are two aspects to this. Number one, that when you're reading about when you're talking about the cadaver, uh, I know that dissection, you're not going to get your personal cadaver. Like it's not like the Munna by MBBS, like apna cadaver ghar se leke aana. So obviously you will be you will be having the same cadaver and everyone will be dissecting on that. So I know that you will not be able to see everything in that minute structures, and the cadavers are also not preserved in the way they should be, so we don't have an ideal cadaver in which you can be able to see all the structures. But there are some really good atlas which are available. I can again send the link for those. I do have those soft copies of the book also. I can share it with you so that you can share it with your students. And regarding, I do have some cadaveric dissection videos on my YouTube channel,
Yes, yes. So
and
they are actually very famous. Everyone recommends
I've
them.
thank you. Well, the only reason for making those videos is because I know that cadaveric dissection is something which people have read about them, but they have not seen the structure how it look like in cadaver here. In the atlas and notebook, we make everything red, green, blue in color here. Cadaver mein, yaar, everything looks same only on the end of the day.
Yes.
So we need to understand those relations. So that's what my recommendation is, that you can go through those videos, or I can recommend you some good atlas here. And Auckland is one of the very good atlas in that regard, actually.
So you were
Macmins and
talking,
Auckland, yeah.
yes. You were talking about Langman. Someone has written, is the edition important of Langman?
But whatever year are you in, that edition will work for you. I don't know. Is it a 13th edition going on right now? If I'm not wrong, 13th or 14th edition is going on. So because there's not much of a change. In the last two edition of the Langman, not much change is there. Only one change I've seen, that is about the neural crystal derivative. So not much is have changed here. The basic procedure of the development will not change much. Some, few things here and there, few markers will change, nothing much. But the reason I'm recommending the Langman here, because when you later on, when you go to give the USMLE exam, some will give PG entrance, some will give next exam, whatever, they generally use that language of the Langman. Whatever terminology Langman is using, they use that here. Like they don't call it epiblast, or they don't call it primitive ectoderm, they call it epiblast. Or they don't call it epiaxial, they call it epimere. So ये छोटा छोटा changes there, and all these changes will matter later on. That's why I'm saying the Langman is a good book to go with.
Thank you, sir. Sir, many had the same type of doubt. See, after reading the gross part, many don't get time for the histology part. So, what should they do in histology? Many are having problem in this part, especially.
Histology syllabus has been reduced a lot actually by NB. I mean, what it used to be earlier, but NMC has kind of cut down the histology part, because what histology we used to read and our actually even my juniors read, that was a little different from what we read nowadays. It is quite less. Histology, what is actually expected from a person is to identify the slide, know about 3, 4, 5 points about it, and just draw one level diagram. Like that's what is needed. I know histology, may we have like all long lectures in the colleges here, but the end of the day, that histology is not asked. And moreover, when you go to second year, like sort of you'll be knowing that when you go to the second year,
Yes.
like in the pathology, we all have to come back to the histology again just to identify the slides here. It's not all the details that we read in the first year is very much needed, but a relevant detail. Like if I'm looking at a nephrotic syndrome slide, so I need to know how a kidney looks like. So that's why basic identification of the slide. Always keep your 5 points ready. Like I always say that when you're talking about a slide, even you give an external examiner, like when you will give your final exam, also final prop exam, always keep your 5 point ready. The point of identification of a slide here. Like these are 1, 2, 3, 4, 5 points, and based on that, I can identify them. Even if you have to write it about it, you just do that. And usually, in most of the universities, the question they ask is about, in the histology, is just about to draw a well-labeled diagram of the so and so histology picture, which you should always draw in a circle only, so that you can limit yourself and just draw the cells correctly, and nothing much. Nobody's testing you for your drawing skills here. And it's about the how technically correct your diagram is. So don't dive too much into histology, because uh, there is no end to it. It's a big science, actually. Histo itself is.
Thank you, sir. Sir, the 2023 batch students, they have their prof exams in July or in August. So
Okay.
they were asking, there is enormous amount of syllabus. How to revise the whole anatomy at the last? Using most of them are using your videos, actually, your notes. So with
Uh,
respect to that, if you can tell.
yeah, I'll let me address both kind of people. There might be some people who attended my classes, my lectures, and some of them who haven't. Some of them must be the one who are made their own handwritten notes, and some are relying on the other notes itself, or they just watch the lectures and then they read from the book itself here. The best idea would have been if you make your own notes. Like I always recommend that. I keep saying in the videos also, like, okay, make your own notes, make your own notes. That's very important because you have a concise material to read with. But now it is not the time for a student who's having an exam coming in 2 3 months to go through every single video. That is not happening actually. What you need to do, you have to pick up your 5 to 6 year like university papers now, and you just take those university papers, put down all the questions at one place. Ki what are the long questions asked in the 4 5 years? What are the short notes asked here? And just kind of organize your preparation around them only here. Like if there's a question, like there's a question on the uterus. If the uterus is something which is very frequently asked long question, so make sure formulate the answer in your head. Ki, okay, agar uterus pe question aega, so these are the points I need to write under here. Relations is this and this is that. Because there are certain topic we read in the video which are just to build a concept here, but they're not important from the exam point of view. We have discussed all the cranial nerves, but not every cranial nerve is asked. So, and because I'm addressing people pan India, so every university have their favorite topics and favorite questions to ask. So it will be a little unfair if I just say, okay, these are the topics that you should read, because I've seen that it's a quite a variation that you find in the different universities here. So I think it's your responsibility to pick up the last 5 to 6 year paper and just read every single question asked in the last 5 to 6 year, and I'm sure that nobody can stop you getting a distinction actually.
So somebody has written everything appears blue and pink in histology. How?
Better that you are, my dear, you're not the only one actually. The unfortunately, the kind of histology slides that we use in our colleges, they are not of great, they're not very well stained, very well, not very well kept. And this is one of the reasons that histo slides that people lose interest in histology, because even if you read in the lecture about, okay, this is how hyaline cartilage will look like, the moment you go into the histology lab and then you see inside under the microscope, then everything looks like different itself. So that is one of the reasons that people lose interest in histo part. But I would say that it's not only the MBBS first year that you have to go through. Histo is something which will definitely come long way. Pathology, histopathology, and this will never leave you. You'll be reading the skin part, dermatology, like, so all these histo slides will always stay with you. So don't get disheartened by looking at all those kind of slides that we have. It's just that don't eat too much that you'll not be able to digest it here. So if hyaline cartilage is something like, even if you know the basics of hyaline cartilage, okay, these are the identification points here, you have to carry this forward to the next year itself, because that will be beneficial here. But what you're saying is absolutely right. In the initial part, if you don't have a concept of histology, everything looks pink and blue only.
Sir, many have written that they have not means studied anatomy so much in their first year, and they are at in their last. So, what should they do now to pass the exams?
Well, I'm not the best person to ask the shortcuts, but still, you've asked me this question, so I would tell Saurabh that this is the best they can do, is because the questions are repeated. Everyone knows that here. Even clinical questions are repeated. They will change the face of the question, but the clinical condition, the important clinical condition stays important only. Facial palsy is important. Shoulder dislocation is important. Like, all these are important questions here. So I would say to those people who have not read anatomy yet, prepare yourself for the LQs at least, because long questions are going to fetch you good marks here. Short notes, where you can never be sure of that what they will ask you. So you don't know then how many short notes you can prepare in. So I think if you are in that position that you just cannot read the entire anatomy, so just have a good hold on this, all this, what do you say, all the long questions. But having said that, if the exam is still in July, I would say that if you dedicatedly sit with those videos for 10 days, because you have to read 3 subjects, man. If you dedicatedly sit for 10 days, I know that 80% syllabus can be covered easily from the videos itself, watching in normal speed itself here. But just that you just have you have to spend like good 8 to 10 hours every day with those videos, writing, and then only it will make. So if you ask me this question like 10 days before the exam, then it would be a different answer. But you still have time. You have still enough time to cover the almost the entire anatomy. But if you still don't want to do that, LQs, long question is the way to go about it.
So, many have asked how to tackle clinical questions, means the applied anatomy part.
But a clinical question, so Clinical, the word clinical itself is something in which, you've got to know, if you know the basics of that topic here, you will get the clinical question in a jiffy only. What I've generally seen in the first year, they don't ask difficult clinical question. हमें लगता है ऐसा कि they're asking difficult, but that is not a difficult question here, because there are limited, I'll tell you something, there are limited areas from where the questions are formulated. So they have to make the clinical question based on those conditions only. Abhi, nobody is going to make a clinical question for you on the Trotter syndrome or your nasopharyngeal carcinoma, because you haven't read that. That is, you will be reading in ENT or something. So they will make a clinical questions on the same basic things only, in which ultimately the answer is uteral prolapse, or it is like something about the shoulder dislocation, or about the knee ACL injuries or PCL injuries, something like that. So clinical question mein, it is not difficult to identify that what the condition is. Having said that, I would say that the best what you can do is, there is a book of Lippincott, and this book is available online only. Again, I can give you the link. That book gives you a good, I mean, there are clinical questions given in that here. So if you want to practice clinical question to understand what given condition is, then you can go through it. Though I would not very strongly recommend you, because there are some very complicated cases also given in that here. But it is a book of anatomy which shows the clinical questions. It's a Lippincott book. Like it's something called as like clinical anatomy by the Lippincott or something like that. I can give you the link for that book here. But if you, as I said, if you just know the last 5, 6, 7 years what clinical questions are being asked here, वही topic पे दोबारा clinical आएगा. You just have to know your concept well. There's nothing special they're asking to the first year.
Okay, so thank you. So, can you tell us about general embryology and the systemic embryology? How to study those?
But the way even I have recorded general embryology and systemic embryology, I would say that sit down at one place and read everything at once only. Don't do that like general anatomy मैंने आज पढ़ा है, I'll read general anatomy today, and then I'll just read the systemic embryology tomorrow, and then I'll read cardiovascular system day after tomorrow, or with the thorax only. You just pick and choose the video from the e-Gurukul or from wherever you are reading it from. But read the embryology in one go only, because it's again a very continuous story. I need to understand how the germ layers are formed, how the neural tube is being formed, how the neural crest cells form, and then you have to apply the same thing in the systemic embryology also. So I think our videos are also, embryology videos
Yes,
are
sir.
hardly like 15, 20 hours videos are there overall, maybe less than that, 15, 16, 17 hours. If you just sit down and just watch the end, all the videos at one go only, I'm pretty sure that that will not take, that you'll be able to finish embryology in 3 days only. But the only recommendation is just read in one go itself here. And at this point of time, the people who are going to appear in the examination, I don't think book is a good idea to read for the embryology, because you will not be able to finish the embryo from the book here. So video, whichever resource, I'm not advocating my resource, whichever resource you want to read from, but just watch the videos for the embryo part here. And if you're a newbie, if you're starting your MBBS here, so please spend some time on the general embryology, read Langman or whatever book, the first 3 week, first week, second week, and third week of embryogenesis. Just make your basics around that initially.
So somebody just wrote what extra they can do for the gold medal and CA exam in their college.
Saurabh, I've been very fortunate in that last year we got some 975 distinctions in anatomy. The people who were my student, 975 gold medals in the anatomy itself. 975 is a very big number that way. So all I'm saying is that trust your resources. You're reading with me, studying with me, well and good. No, if you're reading from somewhere else, fine again here. But just trust your resources and keep going with that. You don't have to do anything extra. It's just that, what, how will you gain an extra marks in something like we don't have to be over smart in answering the questions here. The examiners are very smart. I myself have been examiner for a very long time. So when student write an answer in the first 2 line, I can make out what he's trying to do, and is he trying to make a fool out of me, or he's just trying to represent good information here. All you can do is you can make your paper convenient. If you're asking me what extra you can do, make your paper convenient by 3 ways. Number one, always draw a diagram before the answer. And you will say, oh, we know that, but people don't do that. The reason is when I check someone's paper, if I look at the diagram and if I get the entire information in the diagram only, 90% cases, I already make up my mind that that student knows about the stuff here. So I'm not going to scrutinize his language very, in very detail here. But if you don't draw anything, if you don't draw any flow chart or nothing like that, he just writing text, just filling up the pages only, that kind of eats up a lot of time on mind. And then I just keep on scrutinizing every single line. And that makes me find out a lot of mistakes also, which everyone does. So you have to make it in a such a way that the examiner just look outside from the paper itself and say, okay, the student knows here. Draw well labeled diagram, If it is a nerve or artery course or something, always write it in the flowchart manner. Just put one arrow, 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 arrow. Just keep writing that way here, and try to write as less as you can in the paragraph here. Just presentation is very important from this exam, from these exam here. And histology, I said, always draw the diagram in a circle so that you can limit yourself. And this is all you can do. There is nothing extra which is required from your end. Maybe in practical you can just push a little, and we can have another session for your practical examination once you get over the theory part.
Sir, sir, you just told about the atlas, which one to follow. One student has written how to utilize atlas during their studying.
But first, I want to know ki what student is that? I mean, is
First
he
year
a one
student,
who's
first year.
no? Is he like who's going to start the first year, or is he
No,
like
no,
who's
these are
already like
2023 batch students. They are towards their
okay?
end.
If they are towards the end, then I would say that the just into the in the atlas, the most important thing for you people is the spaces. Use the atlas for mainly for the spaces. You can get a good muscle orientation from any atlas, like netters and all that. That is still okay here. But like cubital fossa, snuff box, spaces in hand, triangles of the neck, popliteal fossa. Similarly, like think of any femoral triangle. All these spaces that we have, for that one should be using the atlas here. And atlas may not help you very much in the abdomen because organs are big, and the kind of relation that we read in the abdomen, that you will not be able to see in any atlas here. For that, only the schematic line diagram or maybe some animations might help you. But for the upper limb, lower limb, on for the neck region, use the atlas for the spaces part here. That would be my recommendation.
Thank you, sir. So these were the questions by the 2023 batch students. Now we have few
Okay.
questions from the NEET PG and the INICT aspirants. So
Oh, we do
someone
have
from
aspirants also here. Okay.
yes, yes, someone from Bangladesh, BGC Trust Medical College. He has asked,
Okay.
uh, also I am a foreign student. Should I give more priority to learning more about FMG exam or mostly focus on my college exams? There is a difference between the details of topics that we study.
Now, what year that guy is in or girl is in who's asking this question? Because
I
are they a
guess
first year
first
student?
year. I guess this is from first year. Someone from first.
Then for the first aid doesn't change much. It doesn't matter even if you're an FMG student, or if you're studying in Nepal, or if you're studying in India. It doesn't make much of a difference. In fact, I last year I was teaching the students in California also, Calgary also. I'm sorry, in Canada, and even there's not much of a difference there, because at the end of the day, what they're asking is the same stuff only here. The details might vary here and there, but because ultimately the competitive exam that you're going to give is an MCQ based exam only. Or MCQ based exam, it doesn't matter that what kind of detail you've read, what top, because topics remains the same itself here. So even when we recommend our student to prepare for the examination, USMLE ho, or if it's an Indian PG exam ho, or if they're preparing for later on for the FRCS or something in the after the PG, we recommend them the same topic only. So I don't think that that he or she need to change anything. If he or she is reading for her university examination, that is good enough, and that would definitely help her in upcoming exam also, the MCQ based exam also.
So there are many fans of you from outside India in Bangladesh also.
Okay, thank you. I keep getting a lot of messages on my YouTube and Telegram, so I keep saying thank you. But I don't get a universal platform to say thanks to everyone. So wherever I get chance, I'll just keep saying thank you so much. I get a lot of messages from Bangladesh, Nepal, and even Pakistan and China, because they kind of, we have the common language here, especially in Bangladesh and Nepal and Pakistan. So a lot of people are using that app also.
So, about many PG aspirants have asked how to study anatomy in their later years of MBBS, integrating with ENT, optha, surgery, and orthopedics.
I always say that pre-final year is the best time to read anatomy. If you haven't read anatomy in your first year, then I would not recommend you to read anatomy in second year, because second year is a time to focus on the physiology-based subject here. Physio, pharmac, pathology, that is like more go hand in hand. So second year, if you're a second year student, let's say, so I would not recommend you to go into the anatomy. Like focus more on physiology part and then micro and pathology. Yeah? But once you're done with the second year and your third year, and if you're in third year, it's a very, very good time to read anatomy. If you don't want to read the entire anatomy, at least head, neck, and face and neuroanatomy, just make a strong base on that here, because that is going to be used a lot in the ENT part and all. And if you're a final year student, so before starting the surgery, I would say yes, that's very much needed, because in surgery, pediatric, orthopedics, everywhere you'll be needing it here. all you can do is that in your final year you can kind of cut down on the head, neck, and face part, and you can focus more on neuroanatomy because neuromedicine will be very much needed here. You need a quick recap of the embryology part because pediatrics will be heavily required. Peripheral nerve injuries because orthopedics you'll be needing that portion also as well. So that I would recommend. But the ideal year for reading these subjects are the second year is a good time to read. If you've not read the subject or you want to revise your subject, second year is a very good time to read the physiology part. And third year is the best time to read all these surgical based subject here. You can finish up your surgery in your third year itself. You don't have to wait for your final year because third year is quite relaxed comparatively. So third year, if you do, I've seen people finishing their final year syllabus in third year itself. Yeah, I mean, okay, medicine and OBG it will take a little go, but surgery they are able to finish it in the pre-final year itself. So third year is the best time to start with.
Thank you, sir. Sir, this question keeps on coming. Is the content of e-Gurukul notes is sufficient for Neet-Pg or anything beyond this topics is needed?
Beta, we just recently had the INICT exam. Just go and watch the interview. The people have, by God's grace, they have praised a lot about anatomy. Dekho, as a faculty, I've been teaching for almost 17 years now to the PG aspirants. UG, I'm teaching from 21 years. So I'll tell you one thing that stays always is the more you get older and you get mature in your subject here, you cut down all your content here. It's my responsibility to reduce the content of the student, not to increase it here. If I keep increasing the content every year, I have to respect the fact that students have to read 19 subjects simultaneously. I cannot impose like way too much of anatomy on them. My job is if there are 15 to 16 questions asked from the anatomy out of 200 in the PG entrance examination, my student should be able to crack 12 to 13 questions in one go. क्योंकि 2 to 3 क्वेश्चन का आंसर किसी को भी नहीं आता होगा. Nobody would know the answer to those questions. So just don't waste your time on that here. So that's my job to kind of filter the content. People keep saying me that sir we saw this question, this we saw. No, don't judge the paper based on 1 or 2 questions here. You have to see holistically that 90% topics are what, and you need to prepare around them only. You have to do the judgment to all 19 subjects. So just reading anatomy is not the only thing you want to do. So I'm not going to increase my content in the e-Gurukul. I might reduce it to 1 or more 2 hours, but I'm not going to increase it because I'm just that's adding the pressure to the head only, nothing else.
Thank you, sir. So I feel that why students means love you so much, including me. I'm a huge fan. Is that you means draw the diagrams and so beautifully you means present your lectures. And many in many places there is just means that actual diagram from the book is taken and taught. So I think means drawing diagrams and teaching means students can relate to that a lot. Mm.
Well, Saurabh, this is a little unfortunate in our country that now we are not using the technology to our advantage. PowerPoint has become a tool, and I feel very sorry to say that even the teachers, the senior professor, they come with PowerPoint in
Yes.
the class and they just do click, 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 and they just go off. What's the point of having this knowledge if you cannot impart this knowledge on someone? So I very strongly feel the reason I draw. See, I can also come up with a already hand drawn diagram. Mera kaam easy hoga. I'll just finish the lecture in quick time itself here. But the reason is I want someone to understand that how exactly they think that thing came into the existence here. Anatomy, I always say, is a subject of anticipation. You have to anticipate what is going to come next. If you don't anticipate that, you will not enjoy it here. One big picture of the Netter's Atlas on the screen, everyone is confused. They don't know what to look, where to look at here. So, uh, but what to do? I cannot change the system. All I can do is I can just teach my own students, and I hope they do well.
Sir, you nicely said that it's a teacher's responsibility to reduce the syllabus rather than increasing it.
Yeah, exactly. See, textbook are flooded with knowledge, yeah. I mean, you want to read a book, the world is flooded with such a great books written over there. My job is to concise and comprise the information into short and give it to them so that it becomes more palatable and enjoyable. Okay. We are all scared of the subject because of the volumes, not because of the complexities here. Because complexities can be solved, but the volume, who will take care of the volume here? Unless you reduce the volume, then this always will be a big headache for everyone. So that's our job. Agar maybe BD Chaurasia, there are 4 or 5 volumes of 3 4 volumes of BD Chaurasia, one for uh, you know embryology, one for histology. If you also make anatomy notes this much here, then who's going to revise them? Students are still struggling in revising the video content. Imagine how can I expect them to revise everything that is given in the textbook?
One has written that means no need to read any book for PG entrance. Lectures are sufficient.
Well, it's a double-edged sword. I'll tell you something. I don't discourage anyone from reading a textbook. I'll tell you why. These lectures that I know that people, when they watch these lectures, they generally don't go and they read them because they think, okay, hamara kaam ho gaya, let's not go and read the textbook. But the point of these lectures is to basically increase your enhancement and understanding of the topic here, so that your job becomes easier. When you open the textbook and you read that, it becomes easier for you to read that way. But having said that, but if you are a first year student, you should read the textbook of anatomy, physiology, biochemistry. You should, and I very emphasize this. If you're a second year student, you should read pathology. You should read Robbins, at least some part, if not everything here, because it's a wonderful book to read. But if you're a second year or third year student, I would not ask you to go back and read B.D. Chaurasia or Vishram Singh there. No, no, that's not happening. If you're a third year student, you cannot come back and read Robbins. Not happening here. So in the respective year, you should read the textbook here. But when you're core preparing for the PG examination, खुद सोचो, if this question is asked by someone who's a first year student, you are having a stress of first year. Just imagine when you're an internship, hectic internship in any hospital, and then you have to revise 19 subjects simultaneously. You cannot fall back to the books here. Even if you want, you can't do that. Even the top rankers, the rank one student, rank two students in Ini-Cet, you watch their interviews. They're solely relied on the lecture notes and all these videos on only, whatever resources they're using.
So you are every year seeing the Neet-Pg and the NICT papers. What do you feel? What is the difference in the approach in these two exams with respect to anatomy?
Yeah, anatomy, and it's not only anatomy, the pre and paraclinical, like anatomy, physiology, biochemistry, microbiology, pathology, and pharmacology. It is a dominant part of the INICT. INICT loves to ask pre and paraclinical. They test the student for the basics mainly. NEET exam is more clinically oriented. They are definitely asking anatomy and all that, but their focus is more mainly on the surgery, medicine, pediatrics, PSM, those portion here. That so from the anatomy point of view, we have almost the same number of questions in both the exam, but again, the more classical questions, the more typical, the more cadaveric anatomy based question, the one which will basically tickle your head, are in the INICT here, because they definitely test their student on the pre and paraclinical. And you watch any video of any ranker of INICT exam, वो सब एक ही बात बोलेंगे. Everyone will say the same thing, that I got the rank because my anatomy, physio, biochemistry, micropath, my pre and paraclinical were very strong here, because INICT since ever always, अभी तो INICT हो गया, it was used to be AIMS and PGI. They always love to ask the pre and paraclinical more. This time, would you believe, in INICT there was only two questions from PSM, only two.
Yes,
There
yes,
were
I saw.
hardly five. There were hardly 5-7 questions from surgery and 5-6 questions from medicine here. But anatomy, pathology, biochemistry, it was like flooded. It was loads and loads of questions from that part. And people who were good at the first and second year subjects, imagine they got a very good rank. I just conducted today only I conducted an interview for rank 41, rank 21, rank 21, 22, something rank is that in Calicut only. And she also told me the same thing. Sir, my pre and paraclinical was very good. That's why I got good rank.
Sir, you just now said that after first year we should revisit anatomy in the third year. Then what should be the means revision resource in the third year?
The resource के लिए again, sort of, I will not advocate it because I'm not advertising for my lectures here, but I would say कि whichever resources you are using, any online resource, be it my resource, be it a prep letter resource, be it Marrow resource, I don't mind. Like, I would not say anyone can need to use that or use this here. But if you're using this, whatever resource you're using in the first year, let's say if you're using some video lectures in first year, if you go back to the same video resource on the third year, that will be better, because you will not be changing the resources and it will be easier for you to grab. My student who read with me in the first year, they'll be a little easier for them to grab in. Today, I had a student sitting in my class in Calicut itself who attended my class like 5 years back in Chennai. And now today he's preparing for the PG exam. He said, sir, I'm feeling like I'm just kind of revising my first year itself. I don't even have to write because every notes is in front of me. I just style ticking mark over there. Yeah. So it is getting a little easier for him. And that's why he came all the way from Chennai to Calicut just to attend this class itself here. So don't change the resource. Whatever resource is that, don't change it here. Stick to it dedicatedly. Everyone is doing a good job. Like, my student would say, okay, I'm teaching well. Someone's student would say they're teaching well. But everyone is doing a good job. जिसके साथ लिंक आपको अच्छा लगता है, जिसके साथ you feel okay, I feel connected, I feel heart to heart connection, I feel okay that faculty is kind of able to make me understand that, just stick to that blindly and don't leave them till you get your PG seat here. तब तक छोड़ना ही नहीं उसको.
Sir, those who have not studied from your main videos, can they study from the revision videos at the last?
Uh, is it for the PG or is it for the first year?
PG,
You're asking.
PG entrance exams.
हाँ, definitely, बेटा. Right now, there is a revision videos available. You can definitely go through the revision videos because most of the contents in the revision videos are covered well. And at the very end, if you like, you still need one more revision. So there is something called as a one shot. So we have one shot videos also available in on eGurukul platform. So you can watch that. One shot video is like 4.5 hour video of the entire anatomy. Just very quick go through everything. So they can do that as well. And the people who are like going to appear for the examination, like upcoming examination, I would say that I'm all every day I'm conducting some quiz in my group also,
Yes,
Telegram
sir.
group, and moreover I'm going to just do a little revision video. I'll come up with a little revision plan on my YouTube channel also, because there were some sectional anatomy questions which were asked this on INICT, so I have to cater them. But till 12th, I'm busy in the classes every single day. I'm outside only. After 12th, I'm going to do that.
Yes, so there was a sectional question asked this year, NICT.
Yeah, they were like quite a few, and ठीक है, if it is asked, so we'll make sure that we'll take care of it.
So one last message you would like to give to everyone regarding it.
Well, the message from me would be this, guys. देखो, and considering that there are a lot of first year students in right now who's listening to me, this is a marathon. It's not a sprint. The people who think, okay, I'll go to the library today and I'll read for 20 hours and this will make my life better. No, that's not going to happen. But if dedicatedly you can just invest even a couple of hours every day, not even a couple of hours, if you can just invest 1 hour every single day, but 1 hour means 1 hour every single day, no matter what. Okay. You don't have to like die at the end and just finishing off the syllabus, running behind this and that. You will be in a very good phase of mind. Whatever rankers I keep meeting, in all these PG entrance examination, these rank 1, rank 2, rank 10 students, they are not special. It's not their special bond. It's not that they were something who always topped in their college, but they were very consistent. They're throughout consistent, and they kind of they never left studying. They enjoyed this journey here. Don't feel it stressful. यार अभी anatomy है, next year pathology होगा. No, if that kind of attitude you will have toward your subject, then you obviously will never succeed in this. You have to enjoy it. You're going to be a doctor. Everything that you're reading today might save some life tomorrow. So you have to see it that way. Whenever you read a topic, it's like, yeah, maybe you never know what comes into you. And I have so many examples to give when it happened in the real time, that so many concepts it came big of our Mbbs time, and it came in front of us, and we are like, okay, yeah, this thing was, now I'm understanding the use of that here. So enjoy this journey, and thankfully nowadays we have all the resources available. There used to be a time when people don't have good resources and they have to rely on the college lectures only, and in some colleges they don't used to teach well. Now though, you have everything at your disposal, so you can use any resource. And this is one of the reasons, Saurabh, I'll tell you, then last 5 years we have seen rankers from every part of the country, every part. पहले क्या होता था कि rankers only from where? Delhi, Mumbai, Bangalore, only big cities produce the ranks here. Abhi, private college, government college, it doesn't matter. Wherever FMG student coming into the Neet-Pg and still getting the rank in top 50, top 20. Okay. So this is happening because the resources are available to everyone, and the people who are smart enough, they'll use it, and they stand a chance in front of anyone. No matter you are from the AIMS New Delhi, no matter you are doing your MBBS from any outskirt, private medical college, it doesn't matter. These platforms have leveled the ground. So take use of that, take advantage of that. So much available, just grab it and just shine.
Thank you, sir, for your valuable time. You gave us so much time from your busy schedule. It was
No,
helpful for everyone. So,
thank
so
you so
if
much. Thank
everyone
you.
wants to means tell sir thanks at the last.
No, you don't have to say thanks to me. Like that's wonderful being here. I can come again to your channel. I mean, to your program when these people will give their university examination. So before the practical, we can have a quick session about a
Okay,
little
sir,
orientation
sure,
about how to go practical about it.
sure, sir.
So yeah.
Sure.
So
Everyone is writing. Thank you.
yeah, I can see that. I've opened the chat right now. I'm seeing that. Thank you guys. Thank you so much, and bless you all. I really wish that we'll meet at some point of time when you prepare for your PG examination and all that. I might get to meet
Sir,
you.
you are also coming to
So
Kolkata for an offline class, I guess.
yes, I am coming to Kolkata. Yes, I
So,
will be coming.
so
I got a
we
schedule for the
definitely try to
Kolkata.
attend that and meet you, sir. Right. So,
Absolutely, most welcome. Most welcome. Yeah.